If you deal with heel pain and you're worried about recovering from a painful surgery, well, this morning, Dr. Vincent Stashak from Mid-Ohio Foot and Ankle is here to talk about a non-surgical resolution. Thank you for coming in.
Thanks.
Okay, so what is the most common foot and ankle issues that you run into as a podiatrist?
Most commonly, it's going to be either plantar fasciitis or Achilles tendonitis, otherwise called heel pain.
Okay. And so what most commonly causes people to suffer from heel pain?
A lot of repetitive activities, exercises, standing on hard surfaces all day long with inadequate shoe gear, improper arch support, not enough cushioning causes trauma to the bottom of the foot over periods of time.
As I sit here and look at my heels, like, improper footwear.
No, those will be fine.
Now, what can be done to help people who suffer from this pain?
So for about 80% of the people, conservative therapy, stretching, icing, physical therapy, night splints, inserts for your shoes, sometimes steroid therapy will resolve your heel pain in a pretty short period of time.
But surgery sometimes also is an option. So what treatment option do you recommend for patients other than surgery?
So for about 20% of the people that do not get better with conservative therapy, your only options are to either live with it or have what's called an EPF, endoscopic plantar fasciotomy, which is a surgery that keeps you down for about 3 months if you have a job where you're on your feet all day long. With what I do, it's high intensity ultrasonic therapy, and it is a in-office procedure, one-time treatment. It puts you back in your shoe the same day, gets you walking the same day, you're back to work within 1 to 3 days, depending on your job. Most people will come back and say, I'm 70, 90% better within 1 week without surgery.
Without surgery. So what is high intensity shock wave treatment?
So it originated about 40 years ago to break up kidney stones and gallstones in the human body without having surgery. So it's a way of breaking up all the calcifications. So just like with the plantar fascia or the Achilles tendon, they are calcifying. It's hardening up over a period of time because it's getting inadequate blood flow to the area. With the high intensity ultrasonic waves, you are able to break up all of that calcification and restore the flexibility to that band of tissue within one treatment.
That's incredible. So what kind of patient feedback have you received from doing this procedure?
So for the last 24 years of doing it and doing thousands of procedures, I would say it's a mid to high 90% within 1 to 5 weeks, people saying, this has changed my life, where I have stopped doing all of my exercises, can't keep up with my kids, and then within a period of 1 to 3 weeks, I'm back to doing everything that I used to do, like pickleball. Pickleball is a big fad out here.
That's big right now.
Right?
Yeah.
And they're like, yeah, they can't believe how fast I'm running back and forth on that court again. So it just gets people back to their normal activities.
And who would be a patient, like a typical patient for you to get this procedure?
So if you've already tried all the conservative therapy, what we discussed earlier, the stretching, the injections, the inserts, and you have no other options other than to live with it or have surgery, don't have surgery.
Don't have surgery, okay.
No, the EPF basically releases a portion of the band of tissue to decompress the nerve. That would be like having a bridge with 4 connecting points, and you're going to go in and you're going to release one of those connecting points to decompress that nerve. Would you drive your car over that bridge?
No.
Not unless I was going to Dukes of Hazzard that thing over that.
Fast and Furious.
And then eventually it's going to just start sagging, which is what happens to your foot.
Okay.
With the high intensity ultrasonic waves, we're breaking up and basically just shining up that bridge and making it all brand new again so that it works the way that it was meant to.
And recovery time is like that.
You're back in your shoe the same day. You just take it easy for 1 to 3 days, let the inflammatory process start. And you have it done on a Friday, you pretty much still go back to work on a Monday, and no more morning pain when you get out of bed, no more pain when you sit down for a half hour, watch TV, and take your first few steps.
Wow. Now, real quick, what happens if the patient needs more than one procedure?
So about 2% of the time, you're so bad off that within 16 weeks, if you are not at least 60% better, I recommend repeating that procedure, at which time now you're pretty close to 100%, breaking up all the calcifications.
Well, I think you've given some good news to our viewers thinking about maybe getting surgery. They don't need that surgery. Don't do it.
Don't do it.
Come to you. Well, thank you, Dr. Stashak, for being here with us today.
Thank you.
And for more information, you can go to midohiofootandAnkle.com or call 740-879-3939. We'll be right back.